Welcome to She's Got Guts, where functional nutrition meets ancient wisdom to bring you grounded insights and practical tools for your wellness journey. Join Lara, licensed Eastern medicine practitioner and wellness wizard, and Molly, registered dietitian and gut health expert, as they unpack trends, tackle bloating, balance hormones, and help you thrive in modern womanhood without completely frickin' losing your mind. Let's do this.
Cougar puberty. My patients love acupuncture and massage and cupping and all that, but magnesium float tanks, like tapping, qigong, yoga, walking, stretching, breath work, all those types of, movement and expression of that cortisol in a way that emits safety to your brain to send that message down to your tissues is really important. And so I tend to focus on that a lot. Like when I have perimenopausal women that I can tell aren't regulated cortisol wise. And, I battle with this myself all the time too. And single mom bubble and changing businesses and entrepreneur and all that stuff. Like it's there and it's real. So yeah, those are, and Chinese herbal formulas, the custom herbal formulas that I write. Yeah. Those are amazing because I'll just give you a quick little example and then I want to hear all about how Molly's going to attack helping with perimenopause as well. So the Chinese herbal formula, I've taken one myself as like a constitutional formula forever. They're those, it's just a little granules. You scoop it, you put it in a mug and you pour hot water over it. The formula is written by a traditional Chinese medicine herbalist or practitioner that has that training. And it's usually very specific to you. Some of them you can write for short term if you have a cold, long term for this perimenopause stuff, so on. So I've been taking a formula called Tianwan Bushendan for a while because for me, perimenopause really showed up as like anxiousness. I never considered myself an anxious person, but realized later on that I had a lot of coping mechanisms that were in place and that wasn't working anymore. And so I had to kind of back up and go, okay, what am I doing? So that worked for a long time. As we're building this bunkie, it's 95 fucking degrees outside and I'm so hot, like temperature wise, I'm hot. And I'm literally doing a CrossFit workout like almost all day. It was like probably 8 hours of work of building this thing. And I was waking up. Never before. I would wake up kind of warm. I'd be like, oh, I'm awake. Oh, I'm a little warm. That's new. Huh. So I knew that like things were shifting. But when I was building that bunkie, I would wake up in a full on hot flash. And I'm like, oh man. So I definitely got my nervous system ticked up and I'm not, I'm asking my physical body to do an intense amount of repair. And I'm also just hot. Like the cortisol and the hotness will really bring on, I think most women could agree that get the hot flashes now, recognize like the temperature definitely makes a difference. And then also like your stress level, like when you get fussy, I find myself when I get fussy, I can feel one kind of coming up. So what I did is I went back and I thought, well, I'm not in a different bubble in terms of my formula. So what I did is I added some more heat clearing herbs. I added some more yin nourishing herbs, and I have barely had any hot flashes since then.
Oh, that's great.
So that's like a big tool that I will use if people are willing to kind of take a little bit of what kind of tastes like Chinese dirt in the morning. But, we can add licorice, ginger, cinnamon. Those are all usually a nice way, applicable, and they taste nice. So that's usually what I end up leaning on.
Those dates that I love.
Yes, datsao. You love your datsao berries.
I do. I'll call you, and everyone else can obviously reach out to you. We'll put the link below.
Yes.
For me, with estrogen, we want to really focus on those liver-loving foods. So things like cruciferous vegetables, right? Vitamin E containing foods, or maybe vitamin E supplements, looking at your glutathione status. So glutathione is a master antioxidant, very strongly interconnected with the liver, and glutathione can be produced as a byproduct of eating broccoli, Brussels sprouts, kale, that kind of thing. It can also be taken as a supplement, but you want to make sure, that you're doing what's right for your body. And if your liver needs support, a supplement is not always the best thing to do. I think vitamin E is a really good, inexpensive place to start, but there are many forms of vitamin E. But the two forms I want to just mention are tocopherol and tocotrienol.
Mm-hmm.
Tocopherols are found more in inflammatory foods, and tocotrienols are found more in anti-inflammatory foods. So looking for a tocotrienol, and Life Extension makes one that's very inexpensive. I think it's like $20. And
Nice.
they are, so it's just 400 milligrams a day. Vitamin E is a fat-soluble vitamin. You would never want to take too much because it's stored in your fat. So that includes your breasts and
Yes.
your butt, and, can easily build up there. But it's also a great supportive thing for your liver. But you can't just take vitamin E and everything's going to be fine. Certainly not. Things
Why
will be
not,
more
Molly? Why
supported.
not?
Yeah, when we look at hormones, like you're saying, want to really focus on the liver, eat those liver loving foods. Artichokes are a great one, prebiotic fibers of any kind. And it's worth mentioning that a lot of foods that your liver loves, your gut bacteria, if they're imbalanced, do not love. So
Yeah.
keeping in mind, you may be listening to this saying, well, all those things make me so bloated and I can't eat them, like beans. Beans is another
Mm-hmm.
amazing one for your liver. That's when we want to maybe talk to someone about digestive support and what's going on with that imbalance, and just making sure that all those things are in order, because all the colors of the rainbow and those really kind of tough on your gut fibers are really the key to good health. So when we eliminate them, especially for a long period of time, we're setting ourselves up to have a really shitty time in perimenopause.
Mm-hmm.
And also to have some impaired pathways of detoxification and of,
Mm-hmm.
hormone detoxification, which is how we keep the levels where they should be. So it's not so much like cruciferous vegetables are going to balance your estrogen and progesterone and testosterone, but more
Right.
that they are going to support the ways in which those things are metabolized or broken down
Right.
in your body.
Supporting those
Um,
systems that support the
yeah.
estrogen. Yeah.
Physical activity, your body loves physical activity, and your body also loves being at a weight that it can carry. And I think that
Yeah.
that's a slippery slope, and maybe we should talk about this, because there's a difference between diet culture
Mm-hmm.
and toxic thinness, right?
Ugh.
And
Yeah.
then being at a healthy weight that is going to support a long health span and
Yes.
older age that is productive. So, just
Mm-hmm.
thinking about that too.
Yeah, that's so true. And especially with a lot of the GLP-1 things that's going on right now. I mean, people are like, "Oh, you look so good." And I'm like, "They look a lot of people they
Malnourished.
look they look malnourished." Yeah. And I'm
Yeah.
like, "Oh
The dark
man.
circles and yeah. Well, and I think,
Yeah.
like we could also do many episodes on GLPs, but there's
We will
a
do a GLP-1.
total.
I think that's actually
We
really
should.
important. And I would love to,
I
I've
would love
heard a
that.
lot of people come to me with alternatives of things that they're trying. And
Mm-hmm.
I'm thinking to
Mm-hmm.
myself, that's actually a really good idea. Like, what
Yeah.
alternatives could you try to a GLP-1? How could you? And
Sure.
then I actually had another conversation actually with my mom recently. She was thinking about it. And I was like, Mom, I actually think that you are a good candidate for that. I think that would work really well. But I think it might be a better idea to like set all your systems up for a few months with maybe some of the
Mm.
alternatives and then go
Yeah.
into it in a very small
Right.
amount and then follow up with
Right.
them afterwards. So it's more of a
Mm-hmm.
holistic approach as opposed to I'm just going to start taking this and, it's going to save me from everything.
Because if the provider of the GLP-1 wants to show results, or if you say like I just want to lose weight, then you'll get to the goal dose. But what they're finding more
Mhm.
and more is that a lower dose, you're going to lose weight a lot slower. It's going to be a lot more gentle on your metabolism. So there are so many ways, right? But what I would say is also, I think that there should be a space for people to talk about, the mental health piece and the fact that a GLP-1 does reduce that food noise. And
Mhm.
sometimes that is a huge improvement in someone's quality of life. So I think that there are like pros and
Yeah,
cons to everything, right?
definitely.
Probiotics, there are pros and cons to those, and we shouldn't already use them for too long. But I do,
Mhm.
overall say that your body is that bitch a temple. So
Mhm.
when you are looking at the bigger picture, we're looking at all of these things and how they interact with each other. It's not just, estrogen dominance is bad. It's like,
Yeah.
okay, what
Yeah.
else is going on? And if
Mhm.
you can't even digest the foods that your body needs to live a long and healthy life, then maybe we start there. Like there's
Yeah.
just, I think people come to me and they want to change 100 things in the same
Yeah.
day, in the same
Yep.
session. And when we go to change 100 things, we change them.
Yes, it's a journey. And remembering that motivation, like it just when you said that, it was like, ooh, ting, that the motivation that makes you show up to someone and ask for help and say, I will do all of the things. Well, one thing to explore is why are you saying that now? What happened that made it so incredibly palpable for you, for your soul, for your spirit, for your mind, for your heart, for your physical body to say, this is enough? And I need to know what it is that I need to move to. I'll do whatever. I see people come to
Yep.
me with low back pain that have been dealing with it for 5 years, and they have one treatment. They're like, "Oh my God, I feel so much better." And it's like because they were finally just fed up with it in their life, and they were like, "I will officially
Hmm.
now do whatever," and I have the motivation. So I think
Right.
it's important when you do start working on that journey, which it is, that you remember what your
Hmm.
motivation is because that's what will keep
Right.
you going. Yeah. So
Absolutely.
I'm
And
curious
as with
when you were
anything.
talking
Hmm.
about movement and the liver. I know we've mentioned this a few times on the show, but it's that sweating mechanism in terms of being great to help detoxify estrogen. That's huge.
And there are two kind of things that go hand in hand, like glucose metabolism, carbohydrate metabolism, and your liver
Mm-hmm.
and your weight. So that's three things. But if you don't have a stable blood sugar, so your blood sugar is going to be more unstable as you get older, especially as you go through perimenopause, because it, like everything else, is like, why isn't the body doing what it always did? Like, what is going on in here?
Yeah.
And then the other piece would be that your response to insulin, which is a hormone, also dampened. And so both of those things together are going to create more fat around your abdomen, plus the lowering estrogen is also going to create more fat around your abdomen. And
Mm-hmm.
when that happens, then again, we're setting ourselves up to then not be able to use insulin even more. So it becomes even less effective with that waist hip ratio, we call it. The
Mm-hmm.
more skewed that is, then the higher our body, the harder our body has to work to do everything
Mm-hmm.
else that it needs to do for metabolism. And again, it's not even like physical activity, sweating particularly can help to redistribute some of that adipose tissue, that fat tissue, in other areas of
Mm-hmm.
your body, and also to turn it to muscle. So it's not about like fitting into a size two. I can see how that would be a harmful narrative, but it is
Mm-hmm.
about doing, when you're fed up with something, then you suddenly have time for it. And I think
Mm-hmm.
this is the part of life where we have so many people to take care of, right?
Yeah.
The parents and the kids and the spouse, maybe, and the house and the job,
Yeah. Yeah.
and the dying dog.
Yep.
And it's
Yeah.
all kind of, like in a place where, well, there's no time for me to support my cortisol and
Yeah.
make sure my body is responding to insulin. But I think when at least we make a short time to sweat every day, then
Yeah.
all of those things get better, because it also lowers your stress. It also calms down your mind. It also helps to
Mm-hmm.
support and promote, those calming neurotransmitters, which then
Mm-hmm.
calms down your gut. And which
Mm-hmm.
then increases how well, you can respond to insulin. I know that all of that sounds really confusing sometimes, and it
Mm-hmm.
feels like, oh, it's so much that I have to do. But really,
Mm-hmm.
if I were to give you three tips, it would be physical activity, like an actual sweat, 15 minutes a
Mm-hmm.
day, even 4 days a week. It
Yeah.
would be a good amount of vegetables, the colors of the rainbow, and especially those cruciferous vegetables, broccoli, Brussels sprouts, artichokes, that kind of thing.
Mm-hmm.
And lastly, it would be supplementation if appropriate. Vitamin E is pretty much safe for everybody. So, I mean, always ask your
Mm-hmm.
doctor, but that's the one that I'll kind of throw out there for now.
I am so
Um,
curious. Yeah, with vitamin E, can you tell me? I understand that it's fat soluble. I know it's really great for hair, skin, nails, this sort of thing, that yin in nature. So it makes sense to me. But I'm curious why vitamin E that you chose that. Like sometimes I would think, oh, maybe D because it's just so engaging to support like our brain health. And when our progesterone's low, we really want brain, you know what I mean? So I'm curious. Tell me why you honed in on the letter.
Not only can it reduce our blood cholesterol levels, because we can talk about that more some other time, but it can lower cholesterol. I could just talk here for 3 hours. It could lower cholesterol levels. It can help with bone loss, so like osteoporosis, which of course the drop in estrogen is also going to
Mm-hmm.
be harder on the bones.
Yeah.
And specifically tocotrienol in research studies is
Mm-hmm.
proven to reduce the fat that accumulates around your liver.
Interesting.
Yep, that's going to obviously make everything work better if you don't have that
Mm-hmm.
visceral fat like around the organ. It
Mm-hmm.
reduces inflammation. It's an anti-inflammatory antioxidant, and it just overall really helps to because that inflammation in the liver, the inflammation from what's going on around the liver is a big, I would say, component.
Mm-hmm.
And this particular element is like the best for that.
Yeah.
Certainly vitamin D is another one. I mean, other things with the liver could be D and B12 and B3, which is niacin, which kind of like opens up your blood vessels and lets blood flow
Flow
freely.
freely. Flow freely. Mm-hmm. That's exactly right.
But too much can make you all red and
Yes.
increase your blood pressure. Anyway, yes, all of that. Vitamin D is great for immune health and all of that. But for the liver, we're looking at glutathione or NAC, which is precursor to glutathione, much cheaper,
Mm-hmm.
much more bioavailable, and vitamin E.
Yeah, I
Those are
love
my top
that. You
two.
know, it's interesting
Yeah.
when you talked about the basically vitamin E's role in the metabolism of cholesterol. What may not be connected for some of the listeners right now is that your hormones run off of cholesterol. Your hormones run off of fat. It's like the lubrication for how things communicate in your body is fat. All of your cells in your whole body have estrogen receptors on it, and they function by fat. So if you're not eating fat, if you're a Gen Xer that you ate in the family that was trained by the baby
Mm-hmm.
boomers to not eat anything that had anything to do with fat because the American Heart
Mm-hmm.
Association had decided at that point in time that those high density lipoproteins were so incredibly terrible for us. Excuse me, low
Mm-hmm.
density lipoproteins were so terrible for us when really it's how we metabolize them and if inflammation is present. And so if you have the ability to have a nutrient come in, like you're saying, vitamin E, and bring
Yeah.
that cholesterol to a healthy metabolism, that is absolutely going to be super beneficial for the hormones and just liberating the liver in general. Like in Chinese medicine, the whole time we've been talking about the liver, Chinese medicine, the liver is what is like, you can kind of think of it like when you're in battle, the liver is like the general. It's going to be like, okay, heart,
Mm-hmm.
I need you to engage here. I need you to engage here. I need you to engage here. It's like the switchboard. And it also
Mm-hmm.
is that way when you have the emotions, like when you have the ability to have
Hmm.
something come at you externally, that you have the ability to respond in a way that's like appropriate, meaning like you can flow with it and stay in that flow, or you can express like the overwhelm of the liver, which is anger. Like legitimately, like
Mm-hmm.
the emotion of the liver is anger. And if you find yourself being very quick to anger and just not being able to respond, then that's a pretty good indicator that the time that you spend to nourish your liver will probably be really beneficial.
Well, and let me please say, because no one seems to know this and no one seems to really believe me when I do say it, but 80% of the cholesterol, first of all steroid hormones are made with cholesterol, and
Mm-hmm.
80% of the cholesterol in your body is made by your liver. So
Yes.
only 20% of it comes from dietary sources. And if you don't eat that 20%, then your liver is just going to make more cholesterol. So you
Mm-hmm.
can't actually, like the diet, it's more sugar and fructose corn syrup
Mm-hmm.
trigger hormones that cause your liver to make too much cholesterol. And that
Yep.
is what actually raises your cholesterol. I don't know
Yeah.
why nobody says that at the doctor. I don't
It's
know why
so
nobody said.
weird.
I'm so confused by that because no one
Yeah.
knows that.
Yeah. Well,
So if your
there's
doctor
a
tells you
really,
to don't eat fat, then
yeah.
say, well, it's more nuanced than that.
Yeah, it is more nuanced than that, and that's absolutely accurate. And actually, it's just recently. I'm so glad you brought this up, and we should probably finish on this because we've been crushing it
I
today
think
with
maybe
our
this will
long
be part
podcast.
two. We're probably
Yeah,
in part two.
yeah. um, But the part of the cholesterol, I had a patient come and sit in front of me earlier that was having some leg pain and some like neuropathy and stuff. And I figured out what the neuropathy was from up above, but I really felt like the leg restlessness and kind of like tendon, they're like dry rubber band kind of thing. I see that a lot in people who are on cholesterol medication. And I think it's just
Mm.
literally because the cholesterol medication isn't allowing them to absorb the fats, which isn't allowing their liver to function properly. And the liver in Chinese medicine opens to the tendons. If you have flexible, brand new rubber band like tendons, you have a very healthy liver, most likely. And so that led me to ask him kind of what was going on with his heart. And he's like, yes, I am on cholesterol. And I was like, well, I'm not going to blame this. I'm just going to plant the seed. And he's like, well, no, that started after I took it. And I've talked to my doctor about it. And they're, the risk of that cholesterol is over, outweighs his restless legs, which doesn't allow him to sleep,
Right.
which to me is very
Yeah.
confusing because then it keeps you
Hmm.
in a stress response and then you're creating more
Yeah.
inflammation. And that is actually a lot more detrimental to your heart than the dietary fat that you're bringing in, because it's not the dietary fat that contributes to the cholesterol in your damn arteries. So
Hmm.
there's a book that I really, really like. And if you're more interested in diving into, like, if you have people in your family that have cholesterol, or you're a woman whose cholesterol increased, like mine did during
Same.
perimenopause, that it's important to understand how those mechanisms work and how they're measuring it for you.
Hmm.
And there's a great book called Outlive, and I can't exactly remember his name right now.
Oh, yeah.
But his
I know
chapter
him.
7 is all about cholesterol health. It's about an hour, and I don't sit and read books. It's just not who I am. I listen, and I
Hmm.
have listened to that almost 3 times because there's this great thing you can test. It's ApoB, and it is so much more indicative what's actually going
Yeah.
on with your heart health than what your LDL and your HDL are doing, and whether or not that doctor is going to get sued for something that may happen. It's such a
Right.
small fraction of the picture of your heart health that it's
Right.
really important to look at it and be educated on what that means, especially if you're a perimenopausal woman who's increasing, because you do want to focus on the other systems that support the heart that test is
Hmm.
not measuring at all.
Hmm. Well, and the cool thing, so that book is by Dr. Peter Attia.
Thank you.
And the cool thing about, yeah, it's a good one. So the cool thing about now is that more and more people are looking at particle size. So like for example, I'm
Mm-hmm.
seeing a client this evening who has an LDL of 80. Oh, that's great. But they have only small and medium size LDL particles, which are more inflammatory, which are more prone to oxidation, versus the
Mm-hmm.
larger pillowy ones, which can actually act protectively. And their
Mm-hmm.
HDL is too low in the overall ratio. Now, if HDL is too high, then it too can be prone to a different size particle that can actually act like the same way kind of LDL does in some ways. So,
Mm-hmm.
keeping in mind that if we just looked at his regular thing, total cholesterol is 150 and LDL is 80, HDL is 30. Okay, so get your HDL up to 50 and you're good to go. But with this,
Yeah.
and there's a lot of tests. So, I have a very clear picture. But with this,
Mm-hmm.
it's really cool because we can say, okay, well, actually, you're at a very high risk of cardiovascular disease and fatty liver, because the two go hand in hand, because
Mm-hmm.
your liver makes cholesterol and your liver is using that ApoB and other proteins to send that cholesterol all around your lymphatic and blood systems, vascular
Mm-hmm.
systems,
Mm-hmm.
to make steroid hormones and to make, energy, and to make sure that, you have cell walls for all the cells, for all
Mm-hmm.
the things. And I just think that we are living in a great time where there is so much information present that it is, again, we can't stress enough that focusing on little things like, oh, how much sugar, oh, I can't eat fruit because it has sugar in it. And you guys just said sugar is bad. Especially fructose actually is bad for the liver, but
Right.
high fructose corn syrup, not fructose from fruit, and even actually not fructose from honey. But that gets, someone hears fructose and they have a large platform, and they can deliver it in an aesthetic way, in a beautiful message, or in a
Mm-hmm.
message that angers people or surprises people. Then everyone thinks that fruit is bad, and
Yeah. It's not
that's
good.
not how it works, you
No.
know
Yeah.
so. Yeah.
Wow, I'm excited that we landed on cholesterol here in this conversation
Yeah.
because I know we talked about heart health up above when we think about what estrogen does. The one of the things that he mentions in the book Outlive is that the percentage of a woman dying from heart disease is incredibly higher than, I think it's 1 in 5 or something, maybe 1 in 3 even.
Number one
Whereas
cause of death
someone
in
dying,
women.
yeah, number one.
Hmm.
And then with breast cancer, it's like 1 in 30 or something, which is, again, still a lot, but
Yeah.
significantly different than 1 in 3.
Hmm.
And
Hmm.
it gets so much more money and attention, and I think we can know why when we think about how cancer is very scary and so on, but how we don't know the cause of death and heart attacks and stuff until they're done.
Hmm.
And you don't get the
Right.
chance to fight it like you do
Right.
with breast cancer or ovarian cancer or
Correct.
cancers in general of the estrogen sorry, what am I trying to say? We've been
Exogenous.
talking a lot. Thank you.
Yeah.
Yes, I was just saying I'm just glad we landed here. I think that is really important. I think it's a big part of understanding that you need fat. Like when you are getting a cortisol belly and you are like, I'm just going to work out more and eat less and it
Yeah.
doesn't work. And you're like,
Uh-uh.
what the fuck is going on with my body right now?
Right.
And all of that. Like, you really do need to keep your heart health in mind. That is very
Yes.
important, is that long term starving yourself of fat is a terrible approach because everything
Hmm.
in your body, primarily your hormones, run off of steroid based things, which is fat.
Hmm.
Good fat.
Your cell walls are made of fat. They have a
Yes.
double-sided, I don't know how to explain it in regular terms
We've been
because now we
talking a
have been
lot
talking
and
a
we're
lot.
both out of adjectives.
Sorry. I know. And my neck is so hot. The last thing that I wanted to say is that women's heart disease risk until the age of 45 is significantly less than men's. It may even be half. I don't quote me
Mhm.
on that, but it's like almost half of men's.
Wow.
And that's because of estrogen. So when estrogen
Yes.
starts to drop around 45,
Mhm.
like significantly drop, women's heart disease rates and heart disease risk factors go up just basically over men's, which turns it
Yes.
into that number one cause of death. And no
Yes.
one tells you that when you go to the doctor. You don't, people say osteoporosis, at least we all know, osteoporosis. No one tells you that you stop absorbing calcium in your bones at the age of 30. And so you're just playing catch up
Mhm.
after that. Could
Yep.
have used that information. And then the
Yeah.
other thing is, okay, well, now hitting it around age 45, you really have to take care of your cardiovascular system. And that means actually eating less sugar and doing a little more exercise. I don't mean
Mhm.
dieting. I don't mean, trying to look really skinny or whatever, and eating more healthy fat, like we're saying. So healthy fats being fish, plant. So that's how I think of it. So fish being any fish or shellfish, obviously, if you're concerned about mercury, if you feel like you don't have very good detoxification, then reducing some of those overseas fish where there is more mercury in the water, larger fish.
Mhm.
And then with plants, avocados, nuts, seeds, olives,
Mhm.
sunflowers, all that kind of stuff. And with that, we are reducing the levels of inflammation. And so vitamin E is found in a lot of those things. So isolating that one vitamin E compound can be helpful. And another one, I think for most everybody, unless you have bleeding disorders or an issue with your heart, would be omega-3. Like a real issue with your heart, so you would have to ask your doctor before you really took anything, would be omega-3. Even if you just supplement like 1,000 and then use the rest for diet, that is a significant anti-inflammatory tool.
Mhm.
And when you were talking about statins and cholesterol medication, so
Mhm.
statins deplete your body of CoQ10, and that's a known fact. So if you're on a statin, you do need to be on CoQ10, but you do just have to talk to your doctor first because you are on that heart medication. CoQ10 also involved in liver health and the fat around the liver. So, not like you're saying, that rubber band, if we can support the things that are being depleted, then the chances of us having fewer side effects from something like a statin are a little greater, right? And again, statins are on a spectrum and you can say to the doctor, like, what dose do you usually give people? And then I'm really hesitant or I have questions, and really have them explain to you why you need to be on, let's say, the gold dose versus titrating up to that dose. A lot of people will say, let me try diet and lifestyle for a few months. And usually they're met with an agreement, thinking about all of that. Like, There are things, you do have the power. You're not a victim of the system, even if you only want to use insurance and that's it. So you wouldn't be getting your lipoprotein size, although we would honestly recommend that test, which a doctor will do, unlike something like a Dutch. You know what I mean? That's $50, but it's going to be hugely beneficial, especially as you get older. There are so many diet and lifestyle things that we can do. Supplements can be beneficial in some ways. Chinese herbs and herb stacks can be beneficial in some ways. And I think Chinese herbs, to me, number one, you have to purchase them from a provider versus supplements that you could get anywhere, including, at the checkout line in TJ Maxx. Please don't do that.
No, they're so old.
They're so old. And then I think a Chinese herbal stack could be really appropriate place to start because, you can just talk to somebody and get that. And it's more like a supporting thing versus you trying to change your vitamin levels or change anything else that's going on. So that's my thought.
Yeah, I love it. That's a great thought. It's so fun. I love that we talked about perimenopause and we ended up in the heart with fat.
Yeah.
That's great.
Love it.
Because we're all anxious and feeling fat. So that worked out really nice. Now you know why. Now you know how to approach it and what to do.
I do. That's great. Yes. I'm totally going to eat some avocados and then I'll report back.
Yes.
We'll do a GLP-1 coming up here. We also are going to do another episode. Please remember to love this. Subscribe to it.
Love it. And we do have a little community. She's got community. It's kind of touch and go, but there's some really good humans there saying really good things. Now it's back to school,
so it'll be go.
Yeah, I know.
The podcast was also touch and go, but here we are.
Yes, I know. The summer can be really tricky.
Lots of fun stuff coming up for you guys. We really appreciate you listening. Thank you for being here. We also have one that coming up. Why does my gut get worse before my period? So we're excited to continue to support you. If you think of anything, shoot us a message.
Yeah, thank you so much. Send in the love.
Thank you so much for listening. We offer personalized support to clients in many ways and would love to work with you. Reach out to Lara at Lala's Wellness and Molly at Women's Gut Health for more information. Unlock your full health and hormone potential with Super Q, Boom Bomb, and Best Tea. Check out the link in the show notes for more. See you next Saturday.